baby was already coming out on the toilet. It wasn't, viable. Very little. It was that little, kidney basin that we have. It was smaller than that. She didn't know she was pregnant.
She didn't know she was pregnant. Are you serious right
That's
now?
what she said.
What she was little?
No.
Big.
Are you serious?
All right. So, Janet, since you wasn't here, you have one of your TV shirts with the suture. Y'all each get to choose one. All right. Who wants to show? Demonstrate how to remove it. All right. So, can you come over here? What do you need to remove?
What's it called? The little, blade?
Yeah. Normal, I like to have the ones, the blade with the handles.
Mm-hmm.
We don't have that blade with the handle. It's ideal. This one isn't, so make sure you control your sharps. You can use the blade, or you can use the scissors if they're sharp enough, but just be careful, it just depends on the wound. Pick your poison.
I'm doing a blade. Alright, so basically you
Do you want any of these other things? I call these teats. I mean, they have a correct surgical name. I'm not a surg tech,
It's, those are hemostats,
the hemostat.
because
Yeah.
they're curved.
Yeah.
They hold the bleeding.
And that's the
vein.
straight
Look closely
hemostat.
Look
What?
closely at it.
Oh, you see how these have like the little
The
edges?
curve, yeah.
So squeeze it in and then push it out.
You actually,
Right
you
there.
would actually use, some people do their ring
It's
finger,
lock right here.
and they work
Yeah.
with both, yeah, it's
you
weird.
gotta pull it
Mhm.
back.
Yeah.
Okay.
And then they navigate with their
Okay,
index
never
finger
mind.
like this, like,
Okay.
watch. So they would navigate like this. That's how they scoop up. So the index finger helps you scoop
I
up,
never knew that.
right? People think it's like this and they go
I
like
thought
that.
it was just like scissors, like
But
you
some
open them
people,
up.
you do what?
So that's
You do
fine.
this one, or some people use literally the ring finger, and then they can maneuver with the middle, and then they can scoop this way. It all depends on how they do it. Some like finesse, some people just need to save their life,
Right.
right? There's no finesse to this,
And
sorry.
you-
There's no finesse, it's not pointy enough to take it out. But there's no,
Yeah.
you understand what I'm saying? So that's all it is. But
So basically,
just so you know,
you could grab this, right?
Uh-huh.
And then go like that.
Yeah. Make sure, there you go.
You seen that?
Mm-hmm.
And then filmate whatever you wanna do.
the instruments that she
And just
has,
make sure, the key thing is when you remove them, that you count how many you removed.
And
as
that
well.
was one.
what's in there, there's needle holder, forceps.
Some are easy
forceps.
where
Does
you
that make
just-
sense? So you have your inventory here.
And when you removing them, do you have to numb them or
Yeah.
Nope, don't even hurt.
it don't? You got to
Unless they come, like again, unless you have somebody who didn't follow, instructions, and they don't, like doctor says, come in 3 days, 5 days, or how many days,
That
and
was
they
quick.
say, they come in 10 days later, and that wound has scabbed over, and they unscabbed over the suture, you know, when you're trying to get some of that scab off and remove it, then it might hurt them, but you still don't gotta numb them.
Okay.
It's just might be uncomfortable a little bit, because now
Like a
you
little
gotta,
tugging.
mm-hmm.
Okay.
Try to get the front.
Watch the sharps, you can lay it down so she can pick it.
She might wanna sit down.
Hey, hold it.
Yeah. So suture removal is pretty simple technique. And then same thing if you had like staples, a staple one is even easier. Even a do staple. It's just like if you had a normal staple, like a staple gun. Exactly what you do. Simple, quick and easy. So if you got somebody who just needs staples, that's so easy and quick. Literally.
They definitely gotta be known for that.
Some do. Some they just do it because the patient already in the hole and they're just like, we're gonna get this done. They don't, some don't even feel it. Especially if they got an injury in like an area where you have like nerves, especially sometimes on the head. It's already kind of numb and they always feel it, so it just depends. All right. So that is suture removal 101.
Okay.
Any questions about suture removal? It's pretty simple, right? The big thing is documenting. maintain control of your sharps, where they are at all times. And counting how many sutures were put in, how many, you removed. Sometimes they might have, depending on the patient, they get them when they come back and they might have lost one already. Hopefully the patient say, oh yeah, one came out.
And
Sometimes
it should be
that-
in a chart how many was in there, so that way you take it out.
Yeah, someone's like, oh yeah, accidentally pulled that one out, or it just popped, or whatever might happen. You never know. Patients can surprise you as well. So, and that's it. Let's move on to the next.
Next episode, in the next episode, yes, Dr. Dre. So what are we doing? Are we going to do the tests right now? We're gonna go straight to EKG. We still gotta do some venipuncture here, and then, I don't know, he's gonna be our manicure, or whatever we do.
I'll take two to do,
The EKG?
no, the sterile technique.
Okay, that's
Open the
fine.
sterile field,
Okay,
and then when I switch, you go to you.
next episode, let's go.
Let me, sharps coming through,
Mm-hmm.
don't wear my shirts. And when you have this long string, you don't have to put the long string in the sharp container. If you need to, you can just clip the needle in, right? And just put that in the sharp. Just clip the needle part. Especially if you still have like a long enough, thread. That situation. Alright. And then some patients too, if they're hairy, after you do some cleaning, just be careful, you might have to take some of their hair out too. Of their skin, people might have depending on the area, might have really hairy legs or hairy arms, it depends on where the wound is, even on the head, or you might have to cut some hair. You never know. You got, what if you had it on your chin right there? You might be losing that little chin hair right, you never know.
What if they don't want their hair cut? You still gotta do it.
We gotta, you want an infection?
Mm.
Cause that's what's gonna happen, if that wound stay open too.
Mm.
They're not treated, you can also be subject to, infection as well.
Okay. For having the hair still on there?
No, if you don't get to.
Because they can't examine it right if they can't
out,
see
make
it.
sure you can approximate the wounds and stuff in a timely manner. Alright. Who needs to go still do some venipuncture practice?
Me.
Alright.